Dr. David Song is the Washington Regional Chief of Plastic Surgery at MedStar Health. He joins us here in the studio. Thank you for joining us.
Thank you for having me, Elaine.
So, let's begin with the young people. We saw in our story all these kids, 1990, born 1990 and after, getting plastic surgery to get into schools, to get jobs, or just to stand apart from others. Other than more disposable income, why is it so popular?
I think there are several things. I think what we're seeing is that we live in an age where we're constantly seeing our image on our phones, on FaceTime, on video chat, and so that awareness, that heightened sense of being and seeing your face brings that awareness to the forefront of someone's sort of being and consciousness. So I think that, coupled with a rise in income across the world, a rising middle class, particularly in China, we're seeing that is a magic formula for this type of explosion.
So is it generational then? Is it part of social media, this selfie generation, where people don't want to use a filter anymore to fix whatever imperfections they have? They just want to do it in real life.
I think so. I think we're living, again, in an era where we're constantly seeing our faces, multiple times a day, not just in the mirror, but on screens, on TVs, on personal devices. And so that, I believe, fuels that heightened sense of awareness.
Are you finding that other people in China are traveling outside of the bigger cities or to even other countries to have plastic surgery done because it may be less expensive?
Well, I think beyond expense, they're seeking excellence. And so we see a lot of my colleagues in Seoul, South Korea, see a lot of Chinese patients coming to Seoul and in Gangnam area. I see a fair number of Asian patients here in DC as well. And so I think they're seeking the best, and they have that ability to do research, and they have the income and the disposable income and the means to do so.
What are the most popular procedures that they and you are seeing with Asians?
We're seeing a lot with double eyelid surgery, as mentioned, rhinoplasty. And rhinoplasty doesn't necessarily mean the big surgeries. There's always ways to do it with fillers to have a natural, gradual result. We're seeing things done with toxins, Botox and Dysport, to enhance the face, lip enhancements. Those are the smaller things. And then you go into the bigger surgeries of breast surgery and breast enhancement and body contouring that are more increasingly common.
We hear and see all these stories about women and young women. Is there an increase in the numbers of men looking for plastic surgery as well?
Absolutely. I'm glad you mentioned that, Elaine. We're seeing a huge uptick in professional men, CEOs. I have a fair number of patients that are CEOs and heads of companies in the C-suite that, they want to look refreshed. I think the added sense of competition in this global economy is driving some of this. They want to be and feel and look their best, and I think that translates in their mind to performance.
All right, Dr. David Song, thank you for your time. We appreciate it.
Thank you for having me, Elaine.